Now, Dr. Sondrop, you and I have been speaking for the last however many minutes, and it's been largely a chat about some of the struggles that South African doctors face. But we also know that South African doctors are quite extraordinary in that the skills that they have from working in South Africa can really be applied internationally. I think of a recent interview that I conducted with a South African doctor working with Doctors Without Borders, who was able to implement an incredible triage system in the field purely because of the experience that he had at South African hospitals. So it's not all bad news for South African doctors, is it?
No, and I certainly hope that's not what I've actually conveyed. I think the situation we still find ourselves in is an enormously privileged one. I mean, I think let's just take a step back for a second. I think the ability to be a doctor is firstly an enormous privilege, because there is no job quite like the one we do. The level of human interaction and the reward, and I'm talking now about non-financial reward, because it's not that great as people think it is. But the level of reward is really unknown. So it's an enormously privileged position to be in. Referring to what you just spoke about, our training capacity and the training we deliver in South Africa is truly of an enormously good standard. It continues to be excellent. It continues to be high quality, and it's simply because we have an enormously diverse patient population. Unfortunately, we have four major burdens of disease that's well known in South Africa. But that has a flip side to it in that it delivers to people training in medicine in South Africa the capacity to have a broad range of experience. And I think that's what people experience when they come and work in South Africa as well, is the access to patient and the range of pathology that we tend to see, and the level of experience that we have, coupled with still very, very excellent medical schools in this country that deliver high quality training.
Finally, before I let you go, won't you tell the viewer watching and those of us who are interested, having heard you speak, what can civil society do to make the work of our doctors in South Africa easier? Should we be lobbying our local representatives for that white paper that we were speaking about earlier? How can we make the lives of our doctors, nurses, and healthcare professionals better and more effective?
Yeah, I think just to focus on that particular sort of comment, I think the white paper I spoke about is not about the paper being available to people like myself and to doctors only, because it's for South Africans and it's for South Africa, and people need to make their voice heard. So when that white paper finally comes, people need to make their voice heard in a constructive way. This is what we need. This is what we want. And I'm sure at some very simple level, most people probably just say they want to be able to access a functional hospital, a functional clinic, go in there, be able to see a doctor, see a nurse, get their medicines, not have to wait in a queue that lasts the whole day or potentially have to come back the next day. And I think that's where the average South African needs to have their voice heard. So when that comes, they should be make their voice heard in that respect. With respect to how people can support us and healthcare professionals, well, I think we need an entire interview just in that. Unfortunately, it's not something I can put in one sentence. But you know, so much of what we see is unfortunately lifestyle-related diseases. And let me just pick on one example, because unfortunately this is not a small question to answer. Our level of substance abuse, and in particular alcohol in this country, has untold consequences. And if we can just start dealing with that issue, for example, people just take more personal responsibility in terms of their own healthcare and their lifestyle. For example, with respect to the level of alcohol consumption, because that has a knock-on effect on interpersonal violence. It has a knock-on effect on road driving and road traffic accidents and pedestrian accidents. And I'm afraid the social consequences of that become medical consequences and become healthcare consequences. So one stupid event by a person who drinks too much can cost tens, if not hundreds, if not millions of rand. and the burden on the healthcare system is enormous. So I'm afraid it's not a small question you've asked me, but that's just one example.
Dr. Sonderup, thank you so much for joining us today.
It's a pleasure. Thank you for having me.